Now, when it comes to foot problems, this is very commonly seen in practice. What I would always say with foot problems is always check the spine first. A lot of problems may start from the pelvis because the pelvis has a big effect on what's going on below. So, for example, if someone's rotated, they're twisting this way, that will mean that the hip can then internally rotate, the knee will then deviate this way, causing foot problems. So a lot of times you've got to make sure that the spine is checked thoroughly. Make sure there's no pelvis misalignments or subluxations first. Then what happens is most of the times the foot also it can be compensating for a hip or a knee as well. So you need to check that as well. So even though someone's coming specifically for foot issues, a lot of times it may come from elsewhere. Now there's a whole range of foot problems. It can be plantar fasciitis, it could be heel pain, like a heel spur, claw feet or claw toes, or even cuboid problems, so on the side of the foot. So especially if it's chronic, it will depend on how they walk. So that's a big effect. So for example, someone who's like very forward tilting, like someone's older, for example, they're walking like this, they're gonna have problems more so on the front of the foot. Sometimes, for example, it's a pelvic problem or a knee problem, and then the foot internally rotates or flat foot, then they're gonna have heel spurs. So when it comes to foot issues, it's a whole range of problems that we need to look at as a whole, not just looking at straight foot only. So I definitely recommend go to a chiropractor, make sure you get yourself checked for the spine first, and then also check for the hip, knee, and then for the foot.